Bismillahirrahmanirrahim. Assalamu alaikum students. How are you? Let's start today's lecture. Today we are going to discuss the norma lateralis. Norma lateralis is the lateral view of the skull. So first we will discuss the bones which we can see lateral in the lateral view. So here is the parietal. Here is the parietal bone. Here is the frontal bone. This is the temporal bone. This is the sphenoid bone. Basically it is the greater wing of the sphenoid. This is the zygomatic bone, and this one is the nasal bone, and this is the maxillary bone, and this one is the mandible, and this is the occipital bone. So these are the bones which are participating in the formation of the lateral norma lateralis. So let's discuss the features of the features we can see in the lateral view of the skull. The first feature we are going to discuss is the temporal line. So there are the two temporal lines. One is the superior and one is the inferior temporal line. Basically, the inferior temporal line is the line which, when goes backward, it turns into the medially and forward and becomes continuous with the supramastoid crest. Here is a crest. We can see I am encircling for you. Here is a crest. We call it supramastoid crest, and it is present just posterior to the zygomatic arch. So the inferior temporal line becomes continuous with the supramastoid crest, and which is continuous anteriorly with the zygoma or the zygomatic arch. So let's discuss what is the zygoma or the zygomatic arch. Zygomatic arch is nothing but basically it is a horizontal bar on this is the okay. This is basically a horizontal bar on the sides of the head in front of the ear. Here is the external acoustic meatus, and external ear will be present over here. It is formed by the temporal process of the zygomatic bone in anterior one-third and the zygomatic process of the temporal bone in the posterior two-third. The zygomatico-temporal suture crosses the arch obliquely downward and backward. Here I am clearing it for you, and again I will show this suture. I am talking about this suture. Okay. Above the zygomatic arch is the temporal fossa. Here is the temporal fossa, which is filled by a muscle which is called the temporalis muscle. And if we talk about the inferiorly, here a muscle is attached which is called the masseter muscle. Masseter muscle is attached downward, and superiorly temporalis muscle and inferiorly masseter muscle. You can feel the contraction of both the muscles temporalis and masseter by just clenching your teeth. Okay. This arch is basically separated from the sides of the skull by a gap, and this gap, I am talking about this gap is basically deeper anterior than posteriorly. The lateral surface of this arch is subcutaneous. The anterior end of the upper border is called the jugal point. This point. I am clearing it for you, and again I will show the anterior end of the upper border is called the jugal point. The posterior end of the zygomatic arch is attached to the squamous temporal bone. This is the squamous temporal bone, and the posterior part is attached to this squamous part of the temporal bone, but basically by two roots. One is the anterior root. Here is the anterior root, and here is the posterior root. The articular tubercle of the root of the zygoma lies on its lower border. Let me clear it for you, and now I will show you. I'm talking about this articular tubercle. This tubercle is lies just at the border where the anterior and the posterior roots meet. This is the posterior root which is continuous with the temporal line and with the supramastoid crest, and this is the anterior border where the articular tubercle is present. And let me tell you that anterior root passes medial in front of the articular tubercle. Articular fossa. The articular fossa means I am saying about this fossa which is also called the mandibular fossa because the temporomandibular joint is formed over here. The posterior root passes backward along the lateral margin of the mandibular or the articular fossa and then above the external acoustic meatus. This is the external acoustic meatus to become continuous with the supramastoid crest. Okay. So this is the posterior root and this is the anterior root. So two roots are present. So let me tell you something more about the temporal bone before telling you about the external acoustic meatus. I will show you another picture, and with this picture this picture. In this picture you can see different parts of the temporal bone. Okay, this is the squamous part of the temporal bone which is larger and bigger, and this is the mastoid part of the temporal bone, and this part is the tympanic part. This is the tympanic, which basically it is covering the external surface of the external acoustic meatus. And for telling you this tympanic part of the temporal bone, I showed you this picture, and then now I will go back into that picture, into the picture we were discussing. Okay, come back over here. So now we are going to discuss the external acoustic meatus. This one is the external acoustic meatus. It opens just below the posterior part of the posterior root of the zygoma. Posterior root of the zygoma. This is the posterior part and posterior root of the zygoma, and it opens just behind it. The anterior and the inferior and the lower part. Let me clear it, and now I will tell you the anterior part, the anterior part and the inferior part and the posterior part and the lower part of the posterior part. These are basically formed by the squamous temporal bone, as I have showed you in the other picture. Where is the squamous part? So this one is the squamous part. So squamous part is forming this boundaries of the temporal. The margins of this external of acoustic meatus are rough. Basically these are rough for the attachment of the auricular cartilage. So let's discuss about the suprameatal triangle. Basically it is a triangle which is present. So it is a triangle which is present over here. This triangle is bounded above by the supramastoid crest and anteriorly by the external acoustic meatus and posteriorly by tangent, which is basically posterior margin of the meatus. The suprameatal spine is present where I am circling. The suprameatal spine is present over here, and the triangle basically forms the lateral wall of the mastoid antrum. What is the mastoid antrum? This is the mastoid part of the temporal bone. So inside the mastoid part, there is an air-filled cavity which is communicating. I'm drawing it over here, but it is present inside, so I will show you by dots. Here is a cavity, air-filled cavity, which is called the antrum, mastoid antrum. It is communicating with the ear. So the triangle is forming the lateral wall of the antrum. So let's discuss about the mastoid part of the temporal bone. So this is the mastoid part of the temporal bone, and here a suture is present. This suture is the schienomastoid suture, and this suture is the rough surface for the attachment of the muscles. This mastoid process of the temporal bone is articulating posteriorly with the occipital bone here through the occipitomastoid suture, and this is the parietal bone, this is the occipital bone. So it is articulating with the occipital bone and parietal bone too. These two sutures are meeting over here. This suture is the parieto-mastoid, and this one is the occipitomastoid. So these two sutures are meeting over here. So this point is called the asterion, as I am encircling it for you. So we have studied it as the mastoid fontanelle when we were discussing the fontanelles. So this is the point of the mastoid fontanelle. In infant skulls, it is present and it fuses till the first 2 years of the life. The mastoid process is basically a projection, a downward projection of this part, and this is basically part of the temporal bone. So it appears after the 2 years, in the second year of life, or after the 2 years. At birth it is not present. So here you can see posteriorly at the occipitomastoid suture, this suture, at the occipitomastoid suture, a fissure is present, a downward projecting fissure is present, and anteriorly over here a fissure is also present, which is called the tympanomastoid fissure. Two fissures I have told you, and a foramen, which is the mastoid foramen, and mastoid foramen we have discussed a lot of time. So the last process, which is the styloid process, this process is the styloid process, and this is basically a needle-like thin and long projection of the temporal part of the bone, and it is basically projecting downward, and its apex is not appearing, or you can say it is hidden behind the ramus. This one is the ramus of the mandible, and the behind the ramus of the mandible, the apex, I am clearing it. Again I will draw it. So the apex of this styloid process lies just behind the ramus of the mandible, and the base, this is the base, which is lying just behind the tympanic part of the tympanic plate. So this is all about the norma lateralis. Hopefully you understood. If you have any question, you can ask me. Thank you.